discuss is your foot. Your foot's actually I would say a lot easier to memorize than your wrist. First of all, the bones are much bigger. So, second of all, most of you guys have never heard of any of the bones in your wrist before, but you might have heard of the heel bone, right? Things like that. So let's take a look at the foot right here, and what we'll notice is this part right here is nice and shiny. This is a part that allows us to form the ankle joint. This top part right here is called the talus, like a talon. Here's a talus over here, and the talus sits on the largest bone of our foot. This large bone forms your heel, and this is called the calcaneus. Notice how the talus sitting on top, and then all these other bones, right, either sit on top or a little bit lower down. Why is that important? It gives us a little bit of an arch. So then when we take a step, you land on your heel, and you're able to kind of roll forward and push up with your toes. We need that arch. All right, so again, talus, calcaneus. As we move forward, you see a rectangular area, rectangular bone right here. This is called the navicular bone. Navicular. Now, the weird one are these three, right? These three are called the cuneiforms. The cuneiforms, you have a medial, because it's the most medial, an intermediate, is because it's the one that's sandwiched between them, and then a lateral cuneiform. Keep in mind, the lateral cuneiform is the most lateral of these three bones. It is not the most lateral of all the bones. The most lateral of the bones are this big, thick one. This is called a cuboid. So the cuboid is the most lateral bone. The lateral cuneiform is the most lateral of the cuneiforms. And here's the intermediate, and here's the medial cuneiform. Now, this, if you take a look, is your big toe. Your big toe is very similar to your thumb in that it only has three bones. You have a metatarsal, proximal phalanges, and a distal phalange. Every other bone we're going to see, right, you have four of them. So take a look, right? You have a metatarsal, proximal, intermediate, and distal. Even your pinky toe has four. So what happens is that when people get their thumb sometimes cut off, right? Usually through industrial accidents or some kind of violent trauma. Thumb is incredibly important. Can you imagine trying to open a doorbell, right? Or a doorknob without a thumb? Driving without a thumb? Or even better yet, most of you guys don't know how to drive stick anymore, stick shift, but trying to drive with a stick shift without your thumb. Really hard. So what happens is they will actually amputate your big toe and graft it onto your first finger. So then you have your thumb again, right? That's how important your thumb is. And actually, if you do damage your thumb, right, you usually get, in terms of getting some kind of compensation, 2 to 3 times the money you would get than if you would damage your other fingers. That's how important the thumb is.